Hello, hello. Can you all hear me?
Excellent. Yes, excellent. We can hear you. All right. Let us get started. Good afternoon, everyone. And thank you
Can
for
everyone hear me?
welcome to the Consumer Cannabis Council's third webinar series, Cannabis Therapies, Families and Pediatrics. Presenter, once again, is the TRIPSI Chief Medical Advisor, Katie Sullivan.
Thank you, Shazia. Okay, cool. If everyone can hear me, let's get started. Good morning. Good morning. Welcome to the third of our presentations that we're doing this summer, the Consumer Cannabis Council. This week, we're talking about one of my very favorite topics, and that's cannabis for pediatric patients. And it's something that in my practice, I sort of specialize in, and I've gotten a lot of joy from working with families to use cannabis safely. So let's get started. I'm going to share my screen. If you guys have questions, please drop them into the chat, and then we'll do Q&A at the end. And yeah, please feel free to ask any questions you have or drop any suggestions for future webinars or things you might want to hear more about. So let's see if I can share my screen for you all. Perfect.
Here, Katie, I'll just...
Is that you,
Katie?
John, or is that me?
Can you hear me, Katie?
Okay. Can you guys all see my screen? John, maybe you should share because I cannot see on my end, if you wouldn't mind. I think it is you sharing your screen, John.
Yeah.
I can see yours.
I was having trouble with audio. Can you hear me now? Can you hear me, Katie?
Can you skip to the first slide, please? John, can you hear me okay? Can you skip to the first slide on yours? Thank you. Apologize, guys. I couldn't get my screen sharing to work. John's going to do it for me. So, like I said, I specialize in this at my practice. And who are these patients? So I apologize, everyone. I cannot see my screen at all. So who are these patients? Pediatric cannabis patients, at least in my home state of Illinois, only make up 2% of the patients in our medical cannabis program. I'm gonna try to share my screen again. Can you guys just give me some feedback? Are you able to see a screen? Okay. There we go. All right. Let's try to do this on my end. Maybe you guys can see it better. All right. So there are 2% of the patients in the state of Illinois. It's a small percentage of people that are using us. These kids tend to have rare, severe, refractory conditions. Usually they have a long medication list. Often they have high incidence of adverse effects, multiple drug sensitivities, food sensitivities. Real common that I see patients with kind of this profile. And often it's families that are considering cannabis as sort of a treatment of last resort. So right now, this is according to the American Association of Pediatrics. Clinical studies support pediatric use of CBD for seizures, THC for chemo-induced nausea and vomiting. Now, that is not coincidentally two of the treatments that we have cannabis-based FDA-approved medications for, Epidiolex for seizures and dronabinol or Marinol for chemo-induced nausea and vomiting. So according to, American Association of Pediatrics, for these seizures or in life-threatening, life-limiting situations, that's when they're recommending use of cannabis. I've seen results with kids with other conditions that I think, it's something that we need more research on, but don't rule this out as an option for your family. We have smaller studies showing efficacy of cannabinoids for things like chronic pain, autism, seizures, spasticity, but especially pediatric research urgently needed. We're lacking. Some of the barriers that families that I see are facing are, number one, a lack of provider knowledge and training. Most doctors are not trained about this, using it in any patients, let alone children. Many institutions and hospital systems would bar their providers from even talking to patients about cannabis for liability reasons. The main reason for this is the second point up here: improper federally scheduling and illegal status of this plant in many areas of the country and federally. It makes it more difficult to access this as a treatment option. And especially when you're, trying to get help for one of your kids, you want to make sure that, you have a provider that is knowledgeable and you're not going to get in trouble for trying to, help your child. And that, goes right into the next point: stigma and fear. There's still a lot of stigma for using cannabis and fear among patients, for getting among parents for getting in trouble for using this with their kids. It's a reality, and depending on where you live, that stigma might and that fear might be more founded. So it's a barrier for people. Again, the cost of treatment is still very high throughout the country, especially in my state. And patients are facing a lack of consistent medical cannabis supply, therapeutic type of products, high CBD products, things like transdermal patches, suppositories that are not purchased by recreational customers, but very much needed by some patients. We don't have a consistent supply for people yet. Same with medical dispensaries. Where you're located is going to depend on your access to getting these products and being able to use them legally. So this is basically what we're facing. It's a gap in care. And, for parents of sick kids, this is very much the reality. They're doing their best to try to help their child, and they don't have a lot of resources. So that is really the point of what we're trying to do here. What the Consumer Cannabis Council is trying to do is be a source of objective information, bring you some of this science, and serve as, a place for you to get resources and to be connected to people like me, cannabis clinicians. When you're working with cannabis with children, I truly, truly, truly recommend that you enlist the assistance of someone who is well-versed and trained in using cannabis, and not just in general, but with children. It's our job to help you do this safely. It's our job to help guide you to, finding the proper regimen and dose for your child, and kind of walk you through the process. Because when you work with cannabis, it's a little bit different. It's not, we don't give you a dose and say, hey, take this every day and it'll be fine. It's very much both an art and a science, and it requires careful titration and observation, especially when using it in vulnerable populations. So, look us up, contact us through the Consumer Cannabis Council if you're looking for someone in your area that could help you with this. So again, I always put this slide in my presentations as we're talking, just so that we, are all on the same page. This is the target. When we're trying to talk about using cannabis to help all these conditions, we are targeting and stimulating the endocannabinoid system. So the endocannabinoid system is one of the largest cell-to-cell receptor networks in our entire body. As you can see in these dots, it's throughout our central nervous system, our peripheral nervous system, our gut, our immune cells. It's controlling things like sleep, like stress response, anxiety, mood, pain response, immune system, so many different things. When you think about the human body and everything that it's doing all the time, I heard someone recently, refer to the endocannabinoid system as the conductor of the orchestra. It is there telling one section, we need a little more of you, telling another section, quiet down over there, we're good, and really kind of orchestrating and regulating our entire experience on this planet as a human. So this is what we're looking at. And as we go in and we touch on some of these conditions that cannabis could be helpful for, I'll always be pointing you back to the endocannabinoid system and some of the differences that we find with, non-neurotypical people, people with seizure disorders, things like that. We find fundamental differences in the endocannabinoid system, which is why it's such an interesting target for treatment. So we'll start off with autism. And since I've been working with the autistic community, I've been learning a lot more about what autism is. There's a lot we don't know and what it isn't. And, trying to listen to autistic people about their experience and the language to be used around autism. So I'm going to share a little bit of that. So, autism, it's not a disease. It is a neurodevelopmental difference. It is a neurotype. And it can manifest itself in communication differences or things like differences in social skills and interaction. Autism, you hear all the time, is a spectrum, but I love this image to the right because it's not a linear spectrum where some people are really autistic and some people are just a little bit autistic. But if you look at this pie chart over here, there are differences in many different areas, and people might have more support needs in some areas than others. So it's not a monolith. Very different people share that same autism diagnosis. And so that's a better way to understand it. Not a linear, but sort of a circle or differences. And the differences can change depending on situation, state of life. So it's fluid. It's not a static thing. And one of the important things that I've been learning is terms like high functioning and low functioning are harmful and outdated. So saying someone is a high functioning is often saying that they're high masking. They're able to fit in as a neurotypical person, functioning in a neurotypical world. They might have support needs. They might be struggling, and they might be higher functioning in some areas, lower functioning in another, just like all of us are. So I prefer to talk about it as support needs, what support needs are needed. So when it comes to cannabis and autism, here's so interesting. Many studies now have shown that autistic people have lower circulating plasma levels of endocannabinoids. So when we talk about that system, the endocannabinoid system, it's a lock-and key system. There are endocannabinoid receptors, and then there are endocannabinoids. The receptors are the locks, the cannabinoids are the keys. The cannabinoids we produce in our own body are called endocannabinoids. Everyone has those, and they're constantly being produced and broken down in our body all the time. They're produced on demand in response to stimuli and stress. And what we're finding is, and let me just say, endocannabinoids are in our body. Phytocannabinoids are the cannabinoids found in plants like the cannabis plant. So the endocannabinoid levels in autistic individuals are so consistently across all these studies low that they're beginning to think of low levels of a specific one of the endocannabinoids called anandamide as potentially being a diagnostic marker for autism, having that low level. So, it's important to note that there is a very hallmark endocannabinoid difference in autistic people, and it's this. The other thing that they found is higher level of CB2 receptors. Those are on usually immune cells or here on white blood cells that respond when we have, illness or injury. So higher levels of CB2 receptors in autistic children, they believe that's a compensation for the lower endocannabinoid levels, that the body is smart. It makes more of the locks so that it can have more chances for a binding of the lock and key, because there's a deficiency of the keys. They're putting locks everywhere in these white blood cells to try to be able to bind with the cannabinoids. Some of the things that I see so commonly in my practice is conditions that are, autoimmune or immune dysfunction conditions, GI issues, Ehlers-Danlos, which is a connective tissue disorder, and epilepsy. Up to 30% of people have co-occurring autism and seizure disorders. So, a lot of these kids and adults that I'm seeing, not only have the autistic neurotype, but they're dealing with many different forms of seizure disorders. It's important to note cannabis is not a cure and autism is not a disease. But what it can be is helpful as a tool to help manage things: anxiety, aggression, self-injury behaviors. That's one that has been very hard to treat. And typically they're giving people antipsychotic medications, sedatives, and they're doing this for kids. CBD, a little THC, works really great for self-injury behaviors. And it's something if that's something that you have a child suffering with self-injury behaviors or elopement, where they get overstimulated and just kind of bolt, these are two things that I think cannabis is a better option to start with than some of the other medications that they're offering up. Same thing, difficulty with transitions is a real common one. Just, getting from school to home and vice versa, and sleep disturbances. So how this is working, we believe, is the endocannabinoid system is modulating neuroinflammation, a hallmark of autism, neurogenesis, and so like creating new neurons and improving cognitive function, improving cell-to-cell communication in the brain, improving our stress response, and improving gut-brain signaling. So there's so many reasons why, as we're learning about this, the endocannabinoid system function has something to do with autism. We need more research, but there's some interesting research coming out. Now, here's my favorite study. And I won't beat your heads in with studies today, but this one's important. This was a small study, but a very valuable insight. There was only 15 participants studying this. So they had 6 to 12-year-olds with autism who had been stable on a cannabis regimen for a year. And so the dosing is interesting. I'll show that to you guys on the next slide. It's because, like I said, it's a very wide variety of people with different symptoms they may be experiencing that have autism. So the dosing is not uniform. And I love that in this study because it really can give you an idea of what this looks like for different people. So what they found are these cannabis responsive biomarkers. These are measurable chemicals that let us know how the cells are functioning. And it's through saliva that they're testing this. So they looked at 3 for this first iteration of this study. NAA, which shows brain function and neuroinflammation, spermine, which is a marker for pain and inflammation, and this DHEAS, which is a hormone, and it's a marker for aggression. So what they found was they tested these kids' saliva, and they had a control group of neurotypical age-matched kids. They looked at the neurotypical kids, and they found there was a specific normal range for these biomarkers. Then they tested the autistic kids, and all of the autistic kids were outside the normal range. Some were lower, some were higher. Then they administered their dose of cannabis and then tested again, I think like about an hour later or something like that. And the biomarkers had changed and had moved back within neurotypical levels. And it was also associated with a reduction in some of these symptoms that they were seeing. So this was like one of the first studies truly showing cannabis doing something to make a change with these specific biomarkers. So when it comes to treating autism spectrum disorder, like I said, like antipsychotic medications or sedatives that they use to treat kids with self-injury behaviors. Well, this study has more evidence in it for using cannabis for that than any of the studies that we, there's not that much research backing up what they're doing with those other medications. And there's a lot of side effects for those meds. So I think that this study is incredibly important. It's Canformatics is the company that's doing this. And they have 2 more studies coming out. This was the dosing. So if you can see, you can see the ages of the children on the left. On the right, you can see all the different cannabinoids they may have been using. So, a lot of these kids were getting good benefit from THC. And if you look right next to it, CBD, look at those doses. Some of them are, in a higher type of range, but that's accurate to what some kids need. The other one that I work with these patients a lot with is CBG, and you can see that was being used kind of with good frequency there, with good amounts. So this is what it looks like when we treat people. We have to start with one cannabinoid, see how they do with that, kind of level someone off there. And then if you're going to add another one, you add that one again slowly. It's methodical, it's slow, but this is the best way to approach this type of, situation, especially with kids, low and slow. So, I want to talk a little bit about sensory processing too, because sensory processing disorder can be like a hallmark of autism, but also its own disorder with people that, don't have an autism diagnosis. So what this is hyper or hyposensitivity to auditory, visual, tactile, olfactory, and gustatory, that's taste input. So these folks have difficulties processing and integrating multisensory information from their environment. Very easily overstimulated. So what we found here is a couple studies have shown this. 3 cannabinoid receptors are abundant in parts of the brainstem that are involved in processing of sensory information, encoding stimuli. So, like, for example, cannabinoid signaling increases odor sensitivity and promotes food intake. So for a lot of people, this could be a good thing, especially when my autistic patients, a lot of them have food sensitivities to smell like this. So increasing odor sensitivity can be a good thing or a bad thing. Just remember that. Helping them try and eat different foods, that's a good thing. But if it increases the smell of certain foods, it might increase maybe, that sort of overstimulation of, the olfactory nerves. The other thing that we see, is a lot of times noise is an issue. And cannabinoid signaling in the auditory brainstem, again, it plays a role in encoding that acoustic stimuli. So it's identifying, like, is this a person talking? Is this a loud noise? And then attaching that almost with, a sensation, positive or negative. So I've seen cannabis potentially, be very helpful for sensory overstimulation and improve the window of tolerance for patients for auditory, visual, olfactory type of sensory stimuli. But I've also seen it have the opposite effect. And, at higher doses, more likely that's going to happen. A highly sensitive individual, really start low and slow and pay attention if this is something that you feel like is worsening the problem. That's always the key. Everyone's different. So each child is unique. So yeah, that's, I'd say it's a mixed bag with sensory processing. People do get relief from it. Some people don't. So worth a shot, I'd say, if it's a big issue. Okay. The other thing, ADHD. This is an interesting one because so many of my patients have ADHD. So what ADHD truly is a neurotransmitter dysregulation disorder. It doesn't mean that you don't have attention. Sometimes the attention is misplaced in the wrong thing. People with ADHD have a tendency and an inability to hyperfocus on things. So the name is a bit of a misnomer, but what they believe the main neurotransmitters involved are dopamine, norepinephrine, and serotonin. And the endocannabinoid system is also involved in those systems as well and influences those neurotransmitters. ADHD is usually diagnosed as either inattentive, hyperactive, or a combined type. And, there's speculation that those different types have to do with like which one of those neurotransmitters is more dysregulated. But what we do know is that there's a lot of evidence now showing genetically based endocannabinoid dysfunction in ADHD patients. That's impaired signaling of the endocannabinoid receptors in the brain and alterations in the breakdown of endocannabinoids. So, there's enzymes that break down those endocannabinoids in our system, and there's differences with people with ADHD. So, again, this is worth looking into with cannabis. Now, again, more research is needed to determine if cannabis is a potential treatment. There was one double-blind randomized controlled trial. In 2017, they had 30 patients diagnosed with ADHD getting Sativex, which is a sublingual spray that has 1 part THC to 1 part CBD, put under the tongue. They took a look at this. The results were meh. I mean, focus was unchanged. They were looking to see if it would improve focus. That didn't help. But there was a significant improvement in hyperactivity and impulsivity and some improvement in inattention. So, I mean, jury's still out when it comes to that study, but anecdotally, patients that use who have ADHD, they do report to me all the time and in literature improved focus, better control of their impulsive behaviors, improved task completion. And what a lot of my patients are using cannabis for is to offset the side effects of their stimulant medication. Cannabis helps improve their appetite and allow them to sleep at night. And so, there's something to be said here. And it's a very common thing that people with ADHD self-medicate with cannabis. So some things that we found is strains high in the terpene pinene, same thing that's found in pine trees, can be helpful for focus. So some of these strains that are high in pinene could be, something for you to check out if you're a cannabis user who has ADHD and is using it for the purpose of work, which a lot of people do. Studies have also shown, benefits for THC, CBD, and CBN, which is a sedating cannabinoid that is produced when THC ages. So all of those three showed potential for improving ADHD symptoms in studies. I will say this, it's important for ADHD patients to try to aim for this lowest effective dose of THC to prevent, number one, the developing of tolerance. There's something with this dopamine dysregulation, especially using inhaled cannabis. It provides a big dopamine reward for people with ADHD. They have a higher level of cannabis use disorder, which is, when you start using cannabis in a way that is not helping you and you are unable to stop. And they have a higher rate of cannabis use disorder than the general population. They have a higher rate of other addictions to other substances as well, but it's particular with cannabis use disorder. And a lot of this, I believe, is they are self-medicating and they're using more THC than they should, and they start developing tolerance. So instead of pulling back on their dose, which is what you should do, they're increasing it to try to get the effect again. And that only works so much before you're like at way too high of a dose and you're dysregulating your endocannabinoid system again. So important for ADHD patients, keep the THC to the lowest effective dose. Okay, this is a big one. Epilepsy is the fourth most common neurological disorder. Seizure disorders is a big reason why I see people. So not 50 people worldwide. That's a lie. 50 million people worldwide have this diagnosis. And the big thing about this is that 30% of patients do not achieve full control of seizures with anti-epileptic drugs. So 70% of people are pretty well managed. 30% of people do not do good on the first line of drugs. And once you're one of those 30% of people, the adding more anti-epileptic drugs will only be helpful in about 5 to 10% of those 30%. So if the medications aren't working for you, it's sort of like adding more of the same isn't typically going to help. But we know that the endocannabinoid system can be an effective therapy target for this because it has anti-epileptic functions, anti-inflammatory functions. Again, neuroinflammation is a big driver of seizure disorders, and neuroprotective functions. So if you have a seizure disorder, incorporating cannabinoids into your regimen can be very supportive. So there are over 400 studies on seizures and the endocannabinoid system or cannabis right now. 88% positive clinical results. That's really good. We don't have that for a lot of things. It's so good, in fact, that we do have an FDA-approved medication, Epidiolex. That is cannabidiol, CBD in an isolate form, and that is a FDA-approved medication here in the United States that you can use and potentially be partially covered with insurance. I've heard some people still having to pay a lot out of pocket for this, but we have a lot of research on this. Now, it's important to note one thing. Cannabis can worsen seizures in 5% of patients. I'd say more likely I've seen that with THC, but it can happen with other cannabinoids as well. The other thing to note too is cannabis itself interacts with anti-epileptic drugs, especially at higher doses. And note those two that I wrote, valproate and clobazam. You want to be using those with extreme caution, if at all, with cannabis. And it's also important to know, don't abruptly stop cannabis when using it for a seizure disorder. For many things, you shouldn't do that. But especially for a seizure disorder, when you get on a regimen, if you're going to try to come off of cannabis, you wean that down slowly. Stopping it can cause seizures to start, and it can be kind of severe. So like any other seizure medication, do not abruptly stop it. Okay, here's what we should remember when we're thinking about our children, right? Consider the risks and benefits. That's what you have to do. It doesn't work for everyone. It's not a magic bullet, but a significant amount of people who try it experience some sort of symptom relief, whether it be improved sleep, improved appetite, improved mood, reduced pain. Most people derive a benefit. What we know of the adverse effects associated with teenage illicit use of cannabis, problematic cannabis use, that would be things like they've associated increased risk of schizophrenia or psychosis. And this is not a causation proved, but correlation. Additionally, just like more negative mental health outcomes. Those studies are based on teenagers using cannabis and other substances illicitly. It's not the same as supervised pediatric medical use, but we don't have a lot of data on supervised pediatric medical use. We see a low incidence of side effects, especially when this is managed carefully, but there's a lot we don't know. And when it's coming to treating your kids, you need to make an informed decision. And part of that is knowing that there's a lot we don't know, and there haven't been a lot of studies done in children. The most common side effects I see with pediatric cannabis treatment, I'm just going for the main cannabinoids here. With THC, it's usually drowsiness or dizziness, right? We try to keep that dose low. We don't want to be getting the kids more intoxicated or intoxicated at all, as needed for that particular patient. But that would be the two most, they're feeling kind of high with THC. With CBD, same thing, somnolence, sleepiness, diarrhea can happen at higher doses. And actually, I see it more frequently at lower doses, that decreased appetite. So, that's kind of the worst of it. Well, this is actually the worst of it. So I like citing this study because this was like a series of case studies, and it was talking about children under 3, accidental THC overdose. And all of these children in this study had eaten hash, straight hash. So, if you know what that is, it's a highly concentrated form of THC. So this is kind of like a worst case scenario. The kids ate a bunch of hash. 58% had an elevated heart rate. 50% had dilated pupils. 24% experienced drowsiness. 20% hypoventilation, meaning their breathing slowed down. 10% became agitated. 4 children had seizures of 29. It's kind of a lot, but that was a very high dose. And 34% had a decreased level of consciousness. So this is a worst case scenario, and they're all alive. They all made it out of this. So, that should give you some idea of, the relative safety of this. If this was, an overdose of Advil, I don't think the results would be as nice as these ones were. I mean, not nice, but it wasn't too bad, right? So just remember, when you're doing this, when you're dosing this with kids, again, get your medical team on board. Find someone like me. Contact the Consumer Cannabis Council, but always remember, start low and go slow, especially with kids. Very low, 1 milligram, aiming for the lowest effective dose. If you're going to use this, if you've done the risk benefit analysis and you found that there are benefits, you still want to be making sure that you're keeping the dosing low. I'd say going for a tincture, which is an oil-based preparation that you put under the tongue if possible, or you can just mix it into food. Depending on the age of the kid, just if you mix it into yogurt, something with fat in it, it's a great way to get that into them. And the tincture, because it's measured by this dropper, it's very controllable. Topical or transdermal applications can also be really helpful for kids. They're not intoxicating. That's better than inhaled. I just never recommend inhaled medicine to kids. It would have to be an extraordinary circumstance for me to do that. Or candy, don't make it the treat that they're going to want to get into. mixing the oil into the yogurt is a safer way to do this, I think. Definitely check for medication interactions. Like I mentioned again, especially these anti-epileptic drugs, you want to double check. Don't stop other medications, especially the seizure medications, without provider supervision. Get your medical team on board. And if you have trouble getting your medical team on board, which is often a thing, again, finding a cannabis clinician, getting a consult, and then allowing the clinician to contact your physician and have that conversation. Sometimes, if your doctor or nurse practitioner knows that there's another provider managing the cannabis part of the care, they're more open to it. Whether or not they're barred or they just don't have the training and don't feel comfortable managing them that part of their treatment themselves. If there's another provider that's doing it that they can work with, they're much more likely to get on board. And again, just store it in a locked container, especially if your child, I have some kids that the only way we can get them to eat it is a gummy or a chocolate. And that's okay, but keep it locked up. You don't want them, getting into the stash. And I like to say this too. Okay. I have a lot of families consult me and say, I've caught my child smoking cannabis, or my child keeps smoking cannabis. We can't get them to stop. Okay. Number one, like I mentioned before, this non-medical teen use has been linked to negative psychiatric outcomes. Causality was not established, but if your child is, using cannabis and getting into trouble, and it's a sign we need to talk. We need to see something could be wrong. So, and a lot of times it could be an undiagnosed condition. Your child could have undiagnosed ADHD, undiagnosed ASD. Autism is way more common. Here in the United States, 1 out of 59 people are diagnosed with autism. There are so many more people that are on the spectrum. Not everyone perhaps needs a diagnosis because they don't have high support needs, but I'd like people to start opening their minds up to the fact that autism isn't, the most, challenged patients that we've seen on specials on TV and things like with cannabis. Though it's really beneficial in patients that, are nonverbal, that have coexisting other neurodevelopmental disabilities. But, your kid, something's going on with your child if they're using a lot of cannabis, and bringing them in to talk about that cannabis use, punishing them is like what parents probably first instinct is to do. But I say, get curious and talk to them about this. So, you want to be careful. We don't want the kids using cannabis while their brain's developing. However, if they have a condition that could benefit from using cannabis, it's that risk-benefit analysis. So if you have a teenager, let them meet with the provider by themselves and with you. So many times when I do that, I get a totally different story from the child about like how much they're using, what they're using. It's helpful for everyone if the child gets that time, and a good provider is going to help them facilitate a conversation with the whole family about what's going on. Definitely want to discuss safety issues, driving. If your patient is a teenager, don't let them give their medication to their friends. Mixing substances, stay away from alcohol or other substances. Do not mix that with cannabis. And laws. It's important that they protect themselves, because the most dangerous thing about cannabis has always been its criminalization and the consequences of that. So, and if you do have a teenager that's using cannabis medicinally, consider cannabis-informed mental health services. It's better to have more people keeping an eye and making sure that there are no unintended negative psychiatric outcomes with this therapeutic use of cannabis. That's just, as always, connect with us, please. Become a member of the Consumer Cannabis Council. We're going to be doing more of these events in person and online. We want to make the information available to you, the consumers and the patients that you want. So we are more than open to hearing about what you'd like to hear about and what topics you'd like us to dive more deeply into. And then that's me. You can find me at Modern Compassionate Care. I consult with people nationwide about cannabis. Here in Illinois, I do medical cards for people and more direct patient care. But even with questions, I can consult with anyone. So if you have questions on this, if you have a child I'm happy to talk with you, and I'm happy to help you find someone in your area who you could see in person. So,
Katie?
All right, let's get to questions. Let me close this.
Katie, can you hear me?
All right, cool. All right, so let's see. Questions. Oh, Joanna, hi. Yes, I can't wait to connect with you as well. I am so looking forward to the work we're going to do on this council, and I would love to hear more about your experiences. That would be great to even talk to you one time on this. So Amy has a question. When you treat kids, are you able to find out what deficiencies and receptors are present? So we're limited on that. There is a company that I'm like checking out right now. This is not an endorsement because I want to make sure that this is legit before I start using it with my patients, but it's called Strain Genie. And it's a DNA test. It's a genetic test, and it can show potential deficiencies in different enzymes, receptor density, things like that. And so I would like to start using this more. A lot of what we're basing our treatment on right now is try, observe, tweak. It would be amazing if we had better access to affordable testing that people could get. But if you are having difficulties nailing down your cannabis regimen, looking at a genetic test such as what they're offering at Strain Genie, and there's a couple other companies doing this, I think it's kind of worth checking out. More on that later. I'm sure I'll update you guys if I find that this is something worth investing in. Okay. Oh, Shazia here. Okay. Is the absorption faster or better with mixing it with fat like yogurt? I would say like the absorption is going to be best with those oil-based tinctures to first put it under the tongue, hold it, and then swallow. But if you're going to mix it with something, definitely fat-based is the way to go, because it's, cannabinoids are fat-based molecules, and you need that to absorb. So I would say mixing it with something like yogurt, peanut butter, anything with fat in it, avocado. I mean, the yogurt's really easy to mix it in, and the oils are usually neutral or not terrible in taste if you mix it with a flavored yogurt. So do it with fat, and the yogurt's a good choice. You know what, Shazia, I'm not familiar with this muscle testing to determine dosing for CBD oil. But that's something I totally want to look into. That's, the closer we can get with this, it's really difficult. It's if we could find a test that would allow us to zero in on someone's dosing, that would save a lot of time. Because right now it really is all about try a little bit. Okay, how did that go? Try a little bit more. How did that go? And then just adjust. That really is how we're doing it. All right, let's see. Once on cannabis, is it intended to stay on cannabis? Are breaks needed? So that's a good one. It depends on the situation, right? If you're using cannabis as a main component to treat a seizure disorder, you might always be staying on cannabis. But however, if you can take tolerance breaks, that doesn't have to be a lot. That could be using cannabis 5 days out of 7 and holding off for 2. It could mean using lower THC and using higher amounts of CBD and other supportive cannabinoids that kind of help your endocannabinoid system stay functioning and kind of help work against the development of tolerance in some ways. When it comes to like my autistic patients, if it's working for them, you can totally stay on it. I don't anticipate that cannabis is going to stop any of the issues that they're using it for permanently, and they can stop using cannabis and it's like, oh, we're okay. I do anticipate that people will need adjustments with cannabinoids and dosing throughout the entire time that they are a medical cannabis patient. It's your endocannabinoid system is fluid, it's changing, it's responding to what you're doing to it. and to what's going on outside and inside your body. So when it comes to cannabis, it's never a matter of like, oh, we found my dose and it's working. Sometimes you could do that and find a dose and it works for a while and then it stops working as well. And that doesn't mean like cannabis doesn't work for me anymore. All that means is time to make an adjustment. And that could mean adjusting the dose of the current cannabinoids, adding another cannabinoid to your regimen to try to increase efficacy. So definitely, when you're using it for something that is a chronic long-term condition, you likely will be using cannabis long-term. So you need strategies like that to kind of prevent tolerance and keep your system reactive, happy and balanced. Am I missing anyone's questions? Did I answer everyone's questions? How do you find products that have the active ingredients that are helpful for conditions? Everything is sativa indica hybrid. So what you want to do is some companies are getting better and posting more information on the labeling, because what you're really going to want to focus in on is number one, especially the cannabinoids. What I recommend is a full spectrum approach. And what I mean by that is something that includes multiple cannabinoids, terpenes, which are the essential kind of aromatic components of the plant that influence how it tastes and smells. They also have therapeutic effects, and the same thing with like flavonoids. So what we're looking at multiple, like the plant is complicated and it's not just one thing, it's many, many things in there. And we find that when you stick close to the plant as it comes out of the ground, utilizing all of these compounds, it works better. So when you want to find these products, number one, you can ask for the COA, the Certificate of Analysis. That is the lab report. Any product in a dispensary has a COA attached to that. That will definitely tell you the cannabinoids, possibly talk to you about flavonoids and terpenes. That would be the number one. Each product is going to have its individual lab report. So take a look at that. If something's working well for you, ask to see that COA. That way you know a little bit more. Now, the other thing you can do is look at websites like leafly.com or Leafly is a good one. Anything that has information about the products that are out there. Leafly often talks about terpenes. And the other thing is like if you've got just a cannabis strain, if you're purchasing cannabis from Cresco here in Illinois, we'll go to the Cresco cultivator website, look up the name of the strain, and it'll at least tell you the primary terpenes in that strain. So it's all about, number one, getting kind of familiar with the lab reports and the labels with cannabis. But number two, what we want to do at the Consumer Cannabis Council is really push for better labeling, more information, make this easier for you to find so that you don't have to track down lab reports, et cetera. But that's where we're at now. Yes, Sherry, exactly. There is a movement, and that's one thing that we are actively talking about at the Consumer Cannabis Council. We want better labeling. People need to be able to make informed choices. Everything's not all the same here, and not every product is created equal. So, we need, as consumers of cannabis, to let these companies know and let the government know, what do we want and what do we need to know. As a medical provider, I need to know this information, and it's too hard to find. Trust me. Oh, thanks, Joe. So how should parents approach a visit to their local dispensary? What are the cautions and concerns? So I would say, find a dispensary that is a medical dispensary here. In at least in our state of Illinois, we have medical dispensaries and we have adult use dispensaries. So for medical patients, the dispensaries you're going to be wanting to use are those medical dispensaries. A lot of the medical dispensaries have patient care, a person that's specifically there for patient care. Not a bad thing to call ahead of time and, let them know that you are coming in, or a first-time patient, and you can actually sit down with somebody there. Now, I like to vet a dispensary before I go to it. You want to go to a dispensary where if you have specific questions about products, they're not just willing, but they're more than happy to answer those for you. Not every dispensary is amazing. Well, the person that asked this question is this amazing cannabis pharmacist who did operate in a dispensary where you could really get this information. And I hope to see more dispensaries doing that type of service. So I would say, be cautioned going in there that, number one, like just depending on what dispensary you go to, they might be recommending you products based on, a lot of them are vertically integrated. They grow the cannabis, they make the products, and then they sell them. And there's different names for each of those businesses. But like if you go to Zen Leaf, their house brand is Verano. So like you're often going to get recommended something that is they're selling it. Is that the best product for you? You want an objective place. You don't want someone that's just recommending their own products. You also, I definitely take a look at the menu online beforehand. That's every dispensary has an online menu. You can see what products they have. That way, what products you might want to ask questions about. Not every dispensary, especially if you're using an adult use one, you can go in there with a medical card, but they might not allow a child under 18 in there. You might want to call about that and make sure my child's a medical patient. Is this child allowed in here or not? And those rules will vary depending on where you live. So, I think kind of all those things, like vet the dispensary, see if they're really offering, any services for patients. Often they do. I work with some great people around my state. Also know this, if you have a question about medication and cannabis or something like that, I learned that in the state of Pennsylvania, they are required to have a pharmacist in every one of their dispensaries. And you can just call up any dispensary, I know Curaleaf has a bunch there. Call up a Curaleaf dispensary and say you want to speak to the pharmacist. You don't have to tell them if you're in a different state. Tell them you have a question about cannabis and a medication. Use that. They are the ones that told me. We don't even, get as many calls as we can field. So that's a good, suggestion as well. If you're looking for some specific information or you have a question and you don't know who to go to, or you don't want to drive to the pharmacy, call a dispensary in Pennsylvania and talk to the pharmacist. Yeah. So, I mean, it's a friendly place. Don't be afraid. Most of the dispensaries are really nice to go into. If you call ahead of time and talk to someone, you can usually set up an appointment. And again, like cannabis clinicians, cannabis nurses like me all over will sit with you. We'll go through dispensary menus. We'll help you plan out your first trip to the dispensary. If you want some hand holding, that's what we're here for. So thank you guys all for coming in. I know we're kind of hitting the top of the hour here. But any questions you have, again, Katie at moderncompassionatecare.com, contact us at the Consumer Cannabis Council. If you guys have any stories to share, I've seen a couple people in here saying like, I've had this great experience. We're totally interested in your story and, what you've been through, because the whole goal and what we're trying to build here is resources for all of us. The companies, they put out a lot of education and some of it's good, some of it's advertising. We really want people using cannabis to kind of have a voice here and have a place that they can come ask these questions, because, it's not always easy to figure out who you can talk to about this stuff. But I really appreciate you guys coming. Again, reach out if you have any questions about this, or if you want to hear more about pediatrics or more specifically about any of these conditions. Happy to do another talk for y'all. So have a wonderful rest of the day. Check out consumercannabiscouncil.com if you guys want to join up and get on our mailing list, and you'll hear about all of the events and presentations that we have planned for the rest of the year. So thank you, everyone. And I look forward to talking to you guys next month. John, I can't remember exactly what our next thing is. I think we're doing mental health, but we'll keep you posted on that. You'll all receive an email with the link to this recording, as well as info for next month's session. Thank you again. Have a good one, everybody.